September is Suicide Prevention Awareness Month. It's a sensitive topic, one that people don't necessarily like to talk about, but one that definitely needs to be spoken about. And speaking of speaking and talking, I have with me in the studio Hazel de Klerk from Let's Talk Psychologists. Good morning.
Good morning. Thank you for having me.
I love the name of the psychologist. Let's talk. Exactly. I mean, just so important. It's so simple, but so important. Let's talk.
Yes.
Tell us a bit about what is it that you do at Let's Talk Psychologists?
All right. I am a clinical social worker. I'm also the general manager of the practice. We are a multidisciplinary team. So psychologists, psychological counselors, and then me as the social worker there.
Okay.
And it's psychosocial support. Some pathology where it is prominent, and then the social issues. So we provide support, individual therapy, family therapy, group sessions. We also do workshops and presentations as well.
Okay. Talk about those social issues. I mean, obviously suicide is a deeply personal thing, but it's also a societal thing. Yes. And we're seeing an increase in the rate of suicide in our society. Why do you think that is? I mean, obviously there's no one cause, but what is contributing to this increase we're seeing?
You're right. We can't pinpoint it and say it's A, B, or C. But some of the major contributors is unemployment rates, financial stress, poverty, and then other factors like alcohol use, substance abuse, because things like those lowers the inhibitions, and then we make impulsive decisions. Cultural isolation, especially amongst our men. They are taught to be strong, to man up and power through. You don't talk about your feelings, everything bottles up, and then it becomes too much, and there's no way out.
So, I mean, talking about those, bottling things up, oftentimes there won't necessarily have been any signs, and a lot of times, personally, I've lost friends to suicide, and I sit and ask myself, why didn't I see this? How did this, how did this catch me by surprise? So sometimes it's not possible to see, but, you were talking about things like risky behaviors, increase in alcohol consumption. Yeah. Are there things that we should be looking out for?
Yeah. Usually our loved ones, we say that we know them well. So it's easy to see when something is off. Someone would maybe become calm after a moment of distress, noticing changes in eating and sleeping patterns, getting rid of things and saying goodbye in weird ways. That usually happens. And then just that rapid change in mood. You notice that people are really down, or a persistent sadness. So those are common indicators, and people who isolate. Like I said, not specific to that, but common factors or stuff to look out for.
So, I mean, you mentioned also that, the lowering of inhibitions, obviously that makes it easier for someone to follow through. And sometimes maybe it is just an impulsive in the moment thing, but as you're saying, there are these signs. How much of suicidal ideation is a long-term process? This isn't something that you just today suddenly decide you're going to do this.
Yeah, look, it varies from person to person. You get someone who is in their natural way, they are on it. If I've made this decision, I'm going to stick to it, and that's what I'm going to do. But these factors that I've identified now, they are longer term, but we in our practice or in our discipline, there is like a diagnostic criteria that you look at with reference to timeline. The past few weeks, past few months, these changes have come in. But like I said, from person to person, it varies. And then that's what it is.
Talking, getting back to the name, Let's Talk. It's not always easy. Obviously, for the person who's going through it, it's not always easy for them to open up and talk, but it's not always easy for us to, maybe see something, even with our loved ones. But I mean, if it's hard with your loved one, imagine you seeing a colleague and you think something's up. How do you break that barrier? How do you approach that person and say, listen, I don't want to step on toes here, but something doesn't seem right?
Exactly that. That is the approach. You want to be gentle, but you want to be direct as well. And we are scared to ask, are you thinking about hurting yourself? Are you thinking about, ending it all? So you want to direct them, and you want to be open, and we don't want to jump and give advice. Many times it's just about having someone that will listen. Okay, and to feel that you are heard, and then to again gently but directly prompt them and say, you know what, maybe it's time that you speak to a professional, and maybe say that I'll go with you, or I'll help you make the appointment, and to help them follow through to get the help that they need.
How easy is that? What are the resources like? I mean, we know in Namibia a lot of our services are stretched. We do not necessarily have enough counselors or psychologists, but how easy is it for someone to access those resources if they need them?
Okay, there are a number of resources in our country. Off the bat, we always say, contact Lifeline, Childline for that immediate response, or for someone to speak to someone immediately.
And that number is again, sorry?
Toll-free lines are 116 or 106. Easy to Google as well. It doesn't cost you anything, and it is available 24/7. So that is the immediate response lines. The mental health unit is there at the Central Hospital. There are skilled professionals, psychiatrists, psychologists, counselors, social workers, mental health nurses. They can provide the necessary support. If needed medication, obviously, all of those things are available there. And then there are individual practices like ours. We do a lot of pro bono work as well, because obviously financial stress is part of the problem. But there are many other practices available. And then at the hospitals and at the clinics, there are social workers, there are mental health nurses. One would want to have it all around the country, but it's something that is not entirely in our control sitting here today.
I'm just thinking, not bigger picture necessarily, but someone like a priest or a coach, if you play sports, or even your GP, can you have that conversation with that person?
Absolutely. When we talk about suicide prevention, we want to take a multi-layered approach. We want to create awareness and break the stigma. And we want to empower people like these. Obviously, general practitioners or doctors, they are trained and skilled. They have their psychiatry rotations during their training and internships and all of that. And they know that mental health is part of the physical health. But we want to empower our community leaders, our teachers, our educators, and our parents, because the prominence of suicide amongst the youth, it is insane. The numbers are off the charts.
Touching then, I mean, you've touched on some of the interventions and some of the things we can do as a society, as a country. How do we address this? It's great that we're talking, it's great that we're trying to raise awareness about it, but is there something bigger that needs to be done in the country to address?
Absolutely. Resources need to be available countrywide. This is where we call out our government and say, listen up, it's time. We need to make sure that there is a mental health unit everywhere, that the hospitals and the clinics are equipped so that people have access to the resources in time. Not where something has happened and now the family or the loved ones are left behind to pick up the pieces. So we want the multi-layered approach, educating our community leaders, our parents, our teachers, and we want to move out resources all over the country.
You spoke about Let's Talk Psychologists doing pro bono work. Obviously, we're chatting today thanks to Renaissance Medical Aid, because they've gotten behind suicide prevention and mental health advocacy. How much more is there that private sector should be doing? We've spoken about government, but private sectors with wellness officers, with interventions.
you're right. We should, empower our community through workshops, through groups, through support groups as well. So sometimes pro bono is necessary, especially in the areas of our country where there is no access. So private sector, yes, let's challenge and let's take the responsibility, because we are our brothers or our sisters' keeper. The suicide prevention is a nationwide thing. It's a nationwide responsibility. So from the private sector, we have to man up as well.
Hazel, thank you so much for talking to us today. And again, I'll just go back because I absolutely love the name. Let's talk.
Yes.
Let's just get everybody talking.
Yes, and that is important for suicide prevention. Speak up. Break the stigma. With RMA and in partnership with Let's Talk, this Suicide Prevention Month.
Thank you.
Thank you for having me.